Welcome, and thank you for joining us for Caregiving Coast to Coast. My name is Amy Feather, and I'm the Executive Director at the Kensington Falls Church, an assisted living and memory care community located in Falls Church, Virginia. Kensington Senior Living has 7 unique communities. 4 are located in Virginia, Maryland, and New York, and our 3 sister communities are all located in California. Kensington is truly privileged to support caregivers from coast to coast. Kensington Senior Living focuses on relationship-based care. Care built on the foundation of our promise to love and care for your family as we do our own. That promise was what initially drew me to become a part of the Kensington organization in 2016. But watching our team live out that promise was what convinced me to move my own mom into our community 2 years later. My mom was my father's caregiver until his journey with Alzheimer's ended in 2010. I was thrilled and so relieved when we were able to move her here to Virginia. As an assisted living leader and a family member too, I see firsthand just how hard caregiving can be, especially in today's rapidly moving and stressful environment. It's essential that caregivers set some time aside for themselves. I want to congratulate you all on taking this time with us today. Whether you've joined us because you're caring for someone or because you support a caregiver, I know you're going to find this gathering informative and helpful. Now, I'd like to introduce Anna Nelson, our moderator for today's session. Anna is the Vice President of Programs and Services with the Alzheimer's Association National Capital Area Chapter. She provides visionary leadership and direction for program development, implementation, and evaluation. Anna has over 25 years of experience as an executive leader in organizational management, dementia specialization, team development, marketing, and program development. She's worked closely with both family members and professionals across the care spectrum. Anna's wealth of hands-on experience in diverse environments includes developing community agency partnerships, education and outreach services, leading family support groups, recruiting, training, and mentoring volunteers and staff, as well as expanding marketing and development opportunities for organizations. As you may have guessed, we consider ourselves quite fortunate to have Anna moderating today's program. Please join me in welcoming Anna Nelson.
Thank you, Amy, and thank you to the Kensington for your leadership in bringing this special program. Hello, everyone, and thank you for joining us for a conversation on caregiving during these unprecedented times. People who are caring for someone with Alzheimer's or other forms of dementia have been faced with increased challenges during the COVID-19 pandemic. For 2 years, we had to accept the forced closures of remote work and the unpredictable reopening plans. It has taken a toll on people living with dementia and their caregivers. Today, we hope to provide you with practical caregiving tips on dealing with the ongoing pandemic, the isolation that continues, and how to take care of your health. We bring experts from coast to coast. I have the privilege to introduce you to our panel. Joining us today are Jenny Peterson, Program Specialist at the University of Southern California Family Caregiver Support Center. Jenny, please tell us a little bit about your work.
Hi, everyone. As Anna mentioned, I'm Jenny Peterson, and I'm in sunny California, where I guess the rest of you are in on the East Coast. So I work for the USC Family Caregiver Support Center. I am a program specialist there, and I work on community education programs for the center, reaching out to caregivers and the community about what it is to be a caregiver and some common issues and topics that that caregivers experience on their caregiving journey. Thank you for having me today.
Thank you, Jenny. We also are fortunate to have Jodi Lyons, Eldercare Expert. Jodi, please tell us a little bit about your work.
Hi, Anna. It's great to be here with you. Well, my first thing I want to say is that, Anna, I'm very proud to have been on your board of directors for the Alzheimer's Association National Capital Area for many, many years. Thrilled to have worked with you. It was quite an honor. In real life, I am an eldercare expert, and I help caregivers and people with dementia find the care they need throughout the country. And actually, this is the first audience to hear. I've just launched and co-founded a new company called carebrains.com to make it a little more efficient for us to help people find the care they need. Our model is that we work for the families and the caregivers and the person with dementia. We do not get paid at all by any of the communities or services we refer to. And as you can see behind me, I have co-authored a book called Brain Health as You Age. It's been out in hardcover for a few years, and February 1st, it just got released in paperback. So that's me in a nutshell, and I'm thrilled to be here.
Thank you, Jodi. We're also fortunate to have Dr. Rita Ghatak, psychologist, gerontologist, Associate Director at Optimal Aging Center, and founder and executive director of Aging 101. Dr. Ghatak, please tell us a little bit about your work.
Can you see me? Okay. Thank you so much for having me here today. This is such an amazing forum, and I'm glad to meet the other panelists. So a brief update on me. I have had my career in gerontology after my research at Stanford. I was the founder of the aging program at Stanford. And for the last couple of years, I have launched my own program, which is Aging 101, which really focuses mostly on patient care, teaching, creating these support networks for caregivers, and a research format in optimal aging centers. So most of my life is centered around working with older adults and caregivers, in terms of especially the dementia journey and many other diseases. And it's such a pleasure to be here today.
Thank you, Dr. Ghatak. We also have Melissa Long, recreation therapist and dementia practitioner. Melissa, please tell us a little bit about your work.
Hi, my name is Melissa Long, and I'm a certified recreation therapy specialist and dementia practitioner in Northern Virginia. I've been in the field for over 20 years, and I have my own business, Recreational Therapy Cubed. And I really focus on supporting both the caregivers and going in and doing person-centered recreational therapy for older adults, which has been very key throughout COVID. I've been able to help people prevent being in isolation. So I look forward to being on this panel and getting to know all of you.
Thank you, Melissa. Thank you to those of you that have submitted your questions ahead of today's program. We will answer them during the panel discussion. For the rest of you, please submit your questions at any time using the chat feature. We will answer them at the end of the panel discussion. And now we're going to go straight into our dialogue with our amazing panel. So I have a question here to get us started. What is the difference between the terms dementia and Alzheimer's? And does having Alzheimer's put someone at risk for getting COVID-19? I would like to direct this first question to Dr. Ghatak. Perhaps you can start the conversation.
Sure. This is a very common question that does get asked. And so if you look at dementia, it's mostly an umbrella term. It's a term that sort of encompasses a lot of other functions such as memory, judgment, decision-making, personality changes. So when we see difficulties in cognitive function, we call it dementia. And Alzheimer's is a type of dementia. So what I usually tell families is think of two nesting dolls. So Alzheimer's would fit into the dementia doll, but not the other way around. So dementia is really the more of an umbrella term. Now, there are many kinds of dementias. Alzheimer's disease is the one we see most often. There are others like vascular dementia, Lewy body dementia, Parkinsonian dementia, and frontotemporal. So it is very important to know the kind of dementia, which is why testing is so important, so you get the right treatment. So that's the first part of your question. And the second one, it's a complicated question. I'm part of a national task force, so we often are looking into, does COVID-19 have a greater impact for dementia patients? And the best way to answer that is the following. It's not that Alzheimer's or having dementia predisposes you to one of these, to COVID, just like, having, a flu is not more for patients with dementia. What we have seen at the research level is that it is hard to manage some of these symptoms for patients with dementia, simply because of the behavioral changes. They're probably not following all the safeguards of, masking or washing hands or social distancing. And you remember when we first started, the pandemic started, we saw a huge uprise in dementia care facilities. That's one part. The second part is there have been 2 recent studies that have come out, and I'm happy to share those resources. We still haven't collected much data, but they are showing that there is a brain component in COVID-19, just because, you lose the sense of taste and smell and some thrombotic or stroke events. And because Alzheimer's is also a brain disease, there is a hypothesis that possibly these are linked, and there could be more mortality among patients with dementia. But overall, we find that many patients with dementia have increased age, other existing conditions. So it is very important to protect our elders who do have this pre-existing condition, which is one of our big efforts here. I know it was a long answer, but I hope I answered it.
Thank you. Thank you so much for your answer, because we constantly get calls from families that are hesitant to take their loved ones to a doctor's appointment.
Exactly. Exactly.
And what recommendations would you have for them? Because those folks really need to see a doctor,
Right.
sometimes.
And, because of the pandemic, we have missed so many screening tests. We have missed some of the symptoms that we should be looking into. So we always talk about balancing it. Is the symptom important enough to be seen in emergency? And I think that's why the dialogue with your primary care doctor, with the neurologist, and thankfully video visits have made that possible. I mean, I sit in on many of these video chats where we go through the symptom. So it is important to go to that emergency room, to get the testing, to go to the clinic, but we always have to weigh protocols. And I think it's a very personal question to be directed to specific caregivers, but you always have to look at the symptom, what is going on, because we cannot miss a stroke or something else just because we are so worried about, exposures. So, but things are improving. Thank you.
Thank you so much I think a lot of our audience will be a little bit more comfortable now and realize that they can take their loved ones out for doctor's appointments. They just have to be careful in practice.
Observe protocols. Exactly.
Exactly. So the COVID-19 pandemic has made caring for a loved one with dementia especially challenging, whether you take care of a loved one at home or if the loved one is living at a facility. What are some of the ways to stay connected and informed? Jenny, could you start the conversation with us on that?
Sure. Some of the ways that family members have been able to stay connected is through video chat. A lot of facilities have set up FaceTime with the residents and their families. Other things that people have done is, if their loved one is in a facility, they're able to stand outside at a window and interact with their loved one who is on the inside. And another one that I've heard of is people will send care packages to their loved ones who are in facilities. And in that way, kind of give them a taste of what's outside, but also to show that they're thinking of them, that they're thinking of their family members who they may not be able to see or talk to in person, but at least, that they're on their minds. Another way is just video chatting, straight old Zoom, like what we are doing right now. So there's definitely a lot of creative ways to reach our family members, whether they are with us at home or if they are living in a facility.
Thank you. Thank you. Melissa, you are a recreational therapist at a number of the Kensington communities. What advice do you have for families?
So a couple of other things that I've worked with families using. So the FaceTime is great, but sometimes people with dementia don't get the concept of it. And how can we give them something that they can understand? So there's actually a retro phone you can plug into iPads and iPhones and Droid phones and tablets. So they're talking on a phone like they did back when they were younger, but they can see the person's face and it makes more sense to them. They can understand that. Facebook Portal has a really nice system where they have almost like iPads you can buy, but they also have one that mounts to the TV. So if your family member has a TV in their location, the camera goes right on the top of the TV and you can call in, and all the staff member has to do is hit yes on the remote when the call comes through, and then they can leave the room. It doesn't have to be managed by anyone, and they're much easier to see because TVs are large. And then the other thing a lot of the families have been doing is getting digital frames, because digital frames have come so far in this day and age where you don't have to get the SIM card out and put it in your computer. I can send pictures right from my phone. And then that way they can see what the grandkids are doing and their kids are doing on the spot. And you can write little messages on them. I've made, a message that says, "Happy birthday, Mom," and sent it, just with letters, to send her a message. So you can do things like that as well. I've also heard of the care package is working well, whether it's a gift or if it's brain games for them to do. And you get on an iPad and go, "Okay, we're going to do this together. I have one thing, you have the other, and we're going to work on it together." And they can do it from 2 locations.
Thank you. I like the idea of the care packages, because for those of us that are long distance caregivers that, that are not able to travel right now because, of restrictions that we still see in some areas, I really like that idea. So thank you so much to both of you. So studies have shown that loneliness and anxiety have risen during the COVID-19 pandemic. How can family caregivers deal with the anxiety, the stress and the fatigue that the pandemic is causing? Dr. Ghatak, what advice do you have for family caregivers?
So this is such an important question, and I think that it is probably asked of everyone, because the one thing I always say in my interactions with caregivers, but also in teaching, that we don't realize how vulnerable the caregivers are, because they're managing their own lives, their own processes, plus now worrying about an older adult or parent or even a spouse. So I think, some of the evidence-based processes that we've used in the past really work. Like, I always start a session by asking them, have they taken care of their own health? Have they gone through the screening test? Do they understand what they're experiencing? It has heightened during the pandemic, and we recognize that. So those measures, then making sure, how I think everybody talks about it, that when you're on a plane, you first put the mask on yourself and then you put it on a child, is remembering that if you don't sleep, if you don't take care of yourself, then you're not going to be able to provide care for not only your family, but also for the loved one. So how to handle this isolation, this loneliness, developing care networks is what I call it, whereby you're reaching out to people to say, if I cannot do this, can you help me out? But also having a proactive plan. So I will sit with my patients and their caregivers to develop a plan that, why are we so anxious? Can we analyze that? Can we see what is it that needs to be done? So creating that plan, what happens, and sometimes it's, about not constantly focusing on what if or what not, because many people are just don't know, they're losing control, because if they're not able to see their loved ones, what to do. So it's a matter of the few of the tips that we have learned, along the way, and just going methodically, self-care, for making time for yourself, speaking to people, your own doctor, therapist, but also connecting as support groups with other people, how they are dealing. So it's not one right answer. Something may work for me. And I've been a caregiver for 35 years with my parents and in-laws, so long distance. So I know exactly what a caregiver feels like.
Thank you. Thank you so much for your advice. A lot of times we hear families say, I don't know why I can't get a good night's sleep, or, you know, I have this list of things that I need to do and I don't have time to do them. And I'll say, it sounds like maybe you need a little bit of help. You know, these could be warning signs of caregiver stress. So I'm going to turn it over to Jodi to, could you contribute to this question as well?
Sure. So the first thing is caregiver burnout is real. And there have been studies looking at professionals and family caregivers and recognizing that none of us can go on forever. We've been doing this for 2 years without a break, some people doing it a lot longer, but you couldn't even go outside and walk around the block for a while. And so one of the important things is to figure out what is urgent and important and what can wait. So for example, the laundry can usually wait. The dishes can wait. Your house may not be perfectly clean. It's okay to take that time that you would take to vacuum the floor and read, or take a shower, or simply sit and do nothing, or have a cup of coffee or tea. Or one of the rules I have is open the front door of your house and walk outside. I don't care if you turn around and walk right back in, but see sunlight, breathe air, whether it's cold or not, and then come back in. The other thing is to recognize, again, when I said caregiver stress is real, I probably should have said dangerous. All of us on this panel and most of the people who are listening in the audience have heard of some caregiver who burned themselves out and they became careless, or they had an accident, or they themselves had a heart attack, a stroke, a fall, or something like that, because they just could not handle the physical and emotional part of caregiving anymore, because we're all only human. So to continue what Dr. Ghatak said is, please call your own doctors. Don't skip your own screenings. Don't skip your own doctor's appointments. Do it virtually if you have to, but don't skip your own healthcare.
Thank you, Jodi. Now that things are opening up and families are going to start taking a second look at perhaps taking their loved ones to an adult day program, perhaps. Jenny, what type of support or programs do you offer caregivers at your center?
What we do is we offer support groups and community education programs for the caregivers to come and attend. And it is sort of what I would call a knowledge is power kind of a thing, because I think it was Dr. Ghatak who said it earlier that a lot of caregivers feel a sense of, you know, losing control, right? And a large part of that is not being able to, not knowing what is going on, perhaps, you know, being overwhelmed with a bunch of information. So in attending events with other caregivers, such as, you know, support groups or community ed programs, it helps them two ways. One being that it sort of gives them information, gives them the knowledge, like, okay, this is what is happening to me, and this is a normal process. And kind of, you know, being able to understand that part, and that sort of helps people with their anxiety and their feelings of loss of control. The other part of that is being around other caregivers really helps, because a lot of times we live in our own heads, right? Caregivers especially, and we kind of think like, oh, I must be the only one going through this, right? And then it's when you go to something like a support group or talk to other people who are in the same workshop or the same class and listen to what they have to say, then you realize, oh, wow, that might, you know, I'm actually going through the same thing as a lot of other people, and I'm not alone in this. Other people do understand what I'm going through. And so I do think that those are, you know, two things that are really, really important for caregivers to keep in mind when they're when they start to feel like they don't have anybody around them to support them, or that they don't know what they're doing, is to kind of get out, be around other caregivers. And even if it's virtually, it doesn't have to be in person. I know a lot of people are still in various parts of the country still a little bit concerned about going out. And there are plenty of online programs, online classes and webinars that they can participate in.
Thank you. During the pandemic, we're coming out of that now, but during the pandemic at the Alzheimer's Association, we saw that our support groups, our memory cafes just exploded. People wanted to meet more often for the emotional support because they found themselves at home taking care of children, their children, working from home and taking care of their parents. Dr. Ghatak, could you talk a little bit about, sometimes people will say, really, a support group? I don't know if that can help. Can you talk a little bit about that, the importance of really reaching out to other people and asking for help?
Right. So I think that, my other expert panelists, I think they said such great things that, so there is a national effort right now. The paper has just come in which we are trying to have primary care doctors actually ask this question. And the question is, are you a caregiver? I think many times people just, we weren't even thinking about that role. So if a physician will ask you, are you a caregiver? That's a very safe place for you to talk about the sense of whether it's feeling out of control or being overwhelmed or what to do, what direction to take. So the physician may actually tell you to take the time to assess, to then proceed towards self-care and asking for help. I think everybody I meet, I tell them that it's okay because you cannot do it alone. And it's a multifaceted, task. We did not live this long before, so we did not understand the immenseness of elder care. There are so many aspects to it, getting the care, doctor's appointments, legal, financial. And most of the times it's on the shoulders of the caregiver. So asking for help, knowing that it's okay to do that, providing them a resource list. I usually give a resource list to say, you can call this for this person. There is so many things, great things around. But also having the health system recognize that the caregiver is such an integral part of the patient's journey. And once that starts to happen, people hear it from physicians that it's okay to reach out. It's okay to get that help, whether it's just a support group or even talking to somebody or even managing your anxiety with better sleep, better exercise, getting those screening tests done. And it's a process. I think we are making good success. I think we are reaching out to quite a few caregivers.
Thank you. I think that's going to bring a lot of comfort to caregivers. Many of us, when we hit a certain age, our doctors will automatically say, okay, these are the tests that you need to get. And they might perform an in-office test for depression. And now
Exactly.
ask this question, and that is just wonderful. I've been in the field for over 30 years, and now we're seeing the impact that while we're waiting for the research community to come out with effective treatments, there's a lot that we can do. And the support systems that are out there is tremendous. So thank you for sharing. Everyone, we're just so fortunate to have this panel of experts who have all kinds of resources. So the COVID-19 variant, all the variants have really made people more hesitant to go back to normal activity. At the same time, people want to live. For those seniors who are taking a closer look because of the pandemic, maybe they're thinking that maybe they should consider an assisted living community for themselves or for a loved one, or assisted community living communities safe. Jodi, as an elder care expert, I bet that this is one of the questions that you get asked a lot. So what do you have to say?
So I do get asked that question multiple times every day. The reason they're asking the question is at the beginning of the pandemic, nursing homes were wiped out. The pandemic, the diseases were going through very frail, vulnerable, sick people. and their bodies just couldn't fight off COVID. Now we have the vaccine. Now we understand the precautions to take. And what we're balancing are the precautions that the communities and care providers are taking. You know, they're testing their staff. The staff is vaccinated. The residents are vaccinated. They have PPE, that would be personal protective equipment, available, and people are being very, very careful. You balance the risk that still exists against the very real risk of what happens in depression and isolation with people not having the social outlets. And what we've seen, and there have been many, many studies on this, are that people who had cognitive impairment of any sort and were isolated socially for the 2 years of the pandemic actually had their diseases accelerate quicker than we thought they would.
Mhm.
And so you're debating are you going to keep the person totally safe at home in a vacuum and nobody comes in and nobody leaves? Or are you going to send them to an assisted living and work with them and perhaps even go with them to the assisted living and trust that that provider is taking care? You can ask, and any of these providers are open. I mean, I know Amy is listening right now. You know full well that Amy can give you a full list of every single precaution they're taking at her building. And the care providers and assisted livings can do that. So what I say is, do not underestimate the cup of coffee factor, the ability for the person with cognitive impairment and or the caregiver to have a cup of coffee with somebody who's in the same boat. Again, depression and isolation versus a virus, you have to make your own judgments, but at this point, doctors will tell you that you need to consider both factors.
Thank you. Thank you for your answer. So now that things are opening up, families can consider a number of options from adult day programs to assisted living communities to bring in home care agencies or all practicing safe distancing and taking all the necessary precautions.
Yes.
We have been talking a lot about the needs of the person with dementia and their caregivers. Another term that we hear is care partners. Now, whether someone is called a caregiver or a care partner, many really don't identify themselves as one. They will say things like, oh, it's just something that I do. I'm not a caregiver. Why do you think that this is the case? Jenny, could you share some insights as to why this might be the case?
Sure. I think a lot of us who are caregivers, we grow up in cultures or families where taking care of someone is just something that you do, right? You end up caring for your mother or your father, uncle or aunt or your brother, you know, et cetera, et cetera. And these are just things that you do. There's not very often a word attached to that, right? And so that's one of the hardest things that we find about trying to raise awareness about caregivers and caregiving issues is that people don't see themselves as caregivers. When they come to our workshops, they'll say, oh, I'm here, you know, they're the family caregiver, but they'll say, oh, I'm here to, you know, to pass on the information to my caregiver. They're talking about their professional caregiver, you know, who is helping their loved one. And they don't really, as I said, they don't really see themselves as the caregiver. They're like, well, that's a job, right? And this is just what I do because I'm a family member, you know, or, and so a lot of times it takes a lot of convincing, I think, when we're trying to raise awareness about these issues that no, you know, you are a family caregiver, you're caring for someone, and these struggles are real. You know, they're not anything to kind of just brush off, right? And once people begin to identify themselves as a caregiver is when they start to realize, oh, there's help for me out there. There's support for me. You know, it's like they can put when they can put a name to that, then it becomes a lot easier for them to sort of start reaching out. But before that point, when people don't see themselves as a caregiver, it's really hard to kind of get them to realize that. So,
right. And I really agree with you on that, is that a lot of times it really takes a while for people to make that call. The first thing we tell families when they call the Alzheimer's Association for support, we acknowledge that we understand that it takes a lot to make that first call, because when you make that first call, that's when you're realizing that it is a diagnosis of some type of dementia, right? You talked about a little bit about the culture. So in some cultures, people don't identify themselves as caregivers. Some see caregiving as a loving duty. Others will see it as a family tradition, something that you're expected to do with no questions asked and none needed. What type of programs or support is out there to help with these types of issues? I'd like to direct this question to the panel as a whole. Who would like to start with that conversation?
I guess I will. So I find with some of the families I work with, kind of meeting them where they're at and finding out what they're struggling with in learning their culture, and finding out from them what they think they need support with, and then kind of slowly putting in other ideas and letting them think it was theirs. Which works, but also looking for the things out there. Here in Northern Virginia, we have a wonderful Asian community where you can get caregivers that are specifically from your country, and there's a senior center specifically for that. And a lot of people don't know it exists, but it's there. And so finding those things for people so that they can have a piece of their culture is so important. And I really strive to do that in my practice when I'm working with people. I learned how to write my name in Hangul a couple weeks ago. One of my clients, taught me how to do that and to do it with the paintbrush and the ink. And, he felt proud because he was teaching me. And I think just going to meet them where they're at, I think is the first point to get through that barrier that's there.
Thank you.
Mm-hmm.
There are also support groups that are specifically, focused on different cultures. We have, for instance, at our center, we have AAPI support groups. We have, Spanish support groups. So there's a lot of different ways to support caregivers. I think it's just, as I said earlier, getting through to them in the first place, getting them sort of aware and identifying themselves as a caregiver. I think, I belong to some AAPI task forces. And one of the things I heard during one of the meetings is, in Asian culture, we don't identify, as being a family caregiver, because that's what you do as a daughter, right? That's what you do as a child, is you take care of your parent. And if you are struggling, if you are suffering, then you suffer in silence, right? You don't ask for help because that's your family duty, right? And I think that this example kind of applies to a lot of other cultures out there, is that not only do you not identify as a family caregiver, but you don't want to complain about it, because then you kind of get this like stigma from other family members. But well, why are you complaining about it? That's your duty. You should be happy, right? And so it's kind of combating a lot of that and having people connect with, again, other people like them in programs such as, support groups and workshops and webinars, and realizing that, they really are not, they're not going through it alone. There's a lot of people out there who are going through the same thing, and they understand. So.
Thank you. I think this is a subject that we can spend a lot of time speaking about this, right? We at the Alzheimer's Association, we have Latino Advisory Council, and in one of the early meetings we had with them, we asked them, what do you think are some of the challenges in reaching the community and getting them to pick up the phone and call us and ask for help, because we know the tremendous toll this disease takes on folks. And they said, we see it as airing your dirty laundry. And I thought, what? And they said, yes, we don't talk about it. You just do it. And I thought, so finding creative ways to bring the message, right? Some studies have suggested these alarming statistics that we're hearing, that between 40 and 70% of family caregivers experience clinical symptoms of depression, which can often be caused by feelings of isolation. Why is social isolation so prevalent amongst family caregivers? How does it impact their health, and what are some of those the strategies for feeling well? I'd like to direct this question to Dr. Ghatak.
So I think, and just, sort of just talking about what the expert panel just said about culture, that, we are finally beginning to motivate health systems. Like, I spend a lot of my time inpatient hospital care, that even to recognize that how a family and a caregiver responds to a crisis in an emergency room or in a hospital, cultures differ, how things are. Now, coming back to so that is one area that I think we need to do a lot more work in, health systems recognizing different cultures and getting them to open up and provide support. But when you look at some family caregivers who find themselves so isolated, and I think everything that the panel has said today, whether you're lonely, whether you're overwhelmed, whether you're doing, you have your own childcare and work, and you then have this other responsibilities. So a group of us, and especially the part that I'm a part of, the Optimal Aging Center, that is entirely focused on clinical depression and how to test it. So it's again about making people aware that if you're experiencing these symptoms, then there is something happening. You need to speak with a psychologist, with your doctor, if you need medication, if you need therapy, but not to miss it. And we are also teaching support groups to be recognizing if particular support person, a member of the support group, is really reacting to it. So again, there are clinical ways of helping. There is, CBT. There is then generalized therapy. There are yoga, all of those biofeedback, alternative, good aspects. But we are recognizing that caregivers are a very significantly burdened group. And lately, if you notice another research, it has gone so much towards caregiving. I mean, there's so much that has come out in the last 4 or 5 years on caregivers, because we are recognizing they are the ones not asking for help. Also, if you look at the age, they are pretty much the ones who are also dealing with childcare, active work, and elder care. And we never had this kind of a sandwich generation where parents are living to their 90s. So there is a larger amount of time dedicated. There are multiple answers. But once again, I feel that if you know someone, and if you're able to reach out and tell them, it's okay to ask for help, it's okay to take the first step, pick up the phone, call your doctor, call somebody, call a psychologist. I think small inroads, but exactly what you're doing today, making it a safe place for a caregiver to ask help. I think people like you and Susan, if you do these kind of panels, it gives people the support to reach out.
Thank you so much, Dr. Ghatak. And with that, you just reminded me, we need to go to the Q&A. Thank you to our panelists for the fantastic conversation. So I'm going to bring up the questions that are on the chat right now. Here's an interesting one. People used to talk about aluminum causing Alzheimer's. Is there any truth to that? I'm going to open that to the panel.
So there is no proven conclusion, even though there's so much of literature on it. Aluminum, as you know, exists in the brain, but the toxicity associated. And it came up in, I think, in the early days for hemodialysis. But right now, there is no real proven theory to it. But there's a huge amount of research around it. I mean, I'll leave it to the other panelists to answer.
Right. And that actually brings up a very good point, which is be careful where your sources are. Right now, we have a doctor on the panel, and she's talking about legitimate research, peer-reviewed, professional, real research. Just because it's on the internet does not mean it's true.
Yeah.
And so again, the safe bet is look for a real medical journal, look to see where the people are who did the research and are they at institutions you would trust, and then move on, because we could have used the word aluminum, we could have used dirt, we could have used a whole lot of other words and asked the same question. We don't really know what the cause is yet of Alzheimer's disease.
Thank you.
So be careful of your resources.
Great point. Another interesting question that came up, when did you stop pushing your loved one to stop eating or to get out of bed? And when does hospice step in for comfort?
I'll start with that one, because that's actually one of the questions that disturbs me the most. All of the dementias that we're talking about get worse over time. We don't yet have the first survivor. I know that's the Alzheimer's slogan, and we're looking for that. But it's a progressive disease, as are the other dementias. People are going to get worse, and they're going to pass away. And what happens is the body goes through changes, and I hope when I finish, Dr. Ghatak will pick up and go through those changes. But the body goes through changes, and there are signs that it is passing away. And one of the things that always breaks my heart is when I see caregivers discussing that their loved one has stopped eating or drinking, and then they try to force them to eat or drink. And then the person gets aspiration pneumonia or chokes. So the answer is, it's hard to learn, but you need to learn the signs and symptoms of when the body is shutting down. And the answer is, it is never too early to call in for a palliative care consult, which is more pain management and control. And hospice does not mean you're killing somebody. It is an ability to change the theory from curative to more, how do you manage and live with end stages of diseases? So again, never too early for palliative care or hospice. And please don't start force feeding people when they're at that stage of life. But Rita, could you go on with when that stage is?
Yeah, I think you just summarized it beautifully. And if I can just share something really personal, I just finished with this consult where, an end-stage dementia patient who now has a very significant infection. And I think that to answer that question is always get the opinion of the primary care doctor, the oncologist, the infectious disease specialist. The good news today in our system, we have multidisciplinary consults. So looking at everybody, and palliative care is one of my favorite topics, because when you come together as a group, as a caregiver, and you're listening to everyone saying that now the body is in this particular stage where really, there is no point in pushing further. In some cases, sometimes it is possible to force feed somebody if you feel that they are at that stage. But if indeed somebody is very close, then having those consults, it assures the caregiver that, we are on the right path. The body and the brain is now hurting. And then to be able to take it. And I think hospice is probably one of the best benefits that we could have gotten. The social worker intakes, the explanations that you get to know that you are providing that comfort. And I think there is always the right time for it. But you don't have to do this alone as a caregiver. You call in the team, you get their reassurance, you work through as a family, you support each other, and you now know that this is a point where you now proceed towards comfort care. That's why they call it comfort care. But you never have to do this alone.
I think it's also important to be looking at quality of life versus quantity.
Exactly.
Something I say constantly. You can do lollipops for comfort if they want flavor so they don't have aspiration pneumonia, but no one wants to be choking on food. It's not a fun thing to have happen. And, just kind of respecting that it's a time to transition. And, you get your doctor's point of view of going, yes, this is the transition time. And then, there could be some other cause and it could be fixable, but that's what the doctor's there for, to make that call.
Thank you. And I think that what I'm hearing is talk to your doctor, get their advice. We're talking about very stressful time in the life of a caregiver. What would be your one big takeaway? What is the one thing that you want our caregivers to take away from today? We talked about the emotional toll that this disease takes. Could we quickly go around and everyone just volunteer one suggestion that of something that a caregiver can do to take care of their own health? We'll start with Jenny.
Sure. I think one thing that a caregiver can do to help with their own health is to start looking at, what screenings you've been missing out on, and to really kind of be able to make your own doctor's visits and go out and take care of yourself. And the thing is, caregivers use so much energy taking care of the other person that there's really very little left for themselves at the end of the day, right? And that's something that that needs to change if it's a long-term thing. People can't continue going on like that for forever, right? And so really being honest with yourself and saying, well, okay, when's the last time I saw a doctor? What are some medical conditions that I probably should get checked out on? And just kind of being able to take the time to do that.
Thank you, Jenny. We'll go quickly to Melissa. I see we're really running out of time. Melissa, you go next.
Yeah, so I think what's really important is to go back to what made you smile. What are some leisure interests of yours? Is it just sitting with a cup of tea and feeling the heat and the smell of the herbal tea that you're drinking? Or is it, now that COVID's, releasing a little bit, going and reading a book while eating lunch? Finding that thing that gave you some joy and giving yourself 10 to 15 minutes every day to have a small part of that, a bubble bath, whatever it might be. Because that's going to recenter you so that you have some energy to go back to the work that you have to do.
Thank you. Jodi, next.
The other thing is, don't feel that you have to take care of the person by yourself at home always, or that the person even needs to be at home all the time. There are great residential providers that you can also consider. It doesn't mean you're putting anybody away. It means you're giving them an opportunity for support and taking care of yourself as well.
Thank you. And Dr. Ghatak?
I think everybody said, such great things. I just wanted to add one thing about, asking somebody for help in terms of sharing the caregiving, but a bigger piece which helped me, because I've had to deal with chronic illness for my in-laws for last 15 years, is creating a roadmap for yourself, understanding the disease that you're dealing with and knowing what the trajectory of dementia is, that there are good days, bad days, and how the early part of the disease versus the latter part. So if you have an understanding of the roadmap, you know what's coming, you have more informed decision making, you have better access, and that helps you prepare for it, which is something I try to do with my caregivers. But thank you for everybody for such great ideas. I took back some great ideas for myself also.
Thank you, Dr. Ghatak, and everyone else from the team. I often say that it's family caregivers who become the experts at finding creative ways to preserve their health and the health of their loved ones. We hope that we have added to that toolbox of resources for you Thank you so much for joining us from around the country. Our panelist contact information will be provided to you. As your moderator from the Alzheimer's Association, always know that we're just a phone call away for information and support. And now I would like to turn it over to Amy for closing remarks.
Thank you, Anna. This was an amazing event. Thanks to all of you for joining us today. We so appreciate spending this time with our very special guests, Anna, Jodi, Melissa, Rita, and Jenny. Thank you so much. It was a really wonderful and insightful event. Each of our attendees today will be receiving a recording of this webinar, along with links to connect you with our distinguished presenters. As we wrap up, I also want to invite you to join us on Wednesday, March 9th at 6 p.m. Pacific time and 3 p.m. Eastern time for another exciting webinar. We will present some breakthrough information on CBD usage and seniors. An opportunity to register will be included in the email you'll receive with a copy of today's webinar. Thanks again for joining us. Have a great evening.
Thank you.
Bye, everyone.
Bye.
Bye.